and let's go through it. Okay, so the spinal nerve is the ones that exit out from the spinal cord, and there's 31 pairs of that. Okay, so each nerve fiber contains thousands of those axons, or what we call the neurons. So there's 31 pairs coming out from the spinal cord, and they connect to the spinal cord. Okay, because your motor is exiting out to the spinal cord, and then your sensory is coming back to the spinal cord. Now, the cervical nerves, there's 8 of them, okay? And 12 on thoracic, 5 on lumbar, 5 on sacral, and 1 nerve coming out from the coccyx. So if you take a look at these numbers, okay, remember there's only 7 cervical vertebrae, but there's 8 of them exit out from the spinal cord because we have 1 extra, which is coming out from the top of C1. So we have 8 and 12 on thoracic, and got lumbar 5, sacral 5, and coccyx 1. So the total would be 31 pairs of spinal nerves. Okay, and the spinal nerves will create what we call plexus, and plexus are a mix of the ventral rama of the spinal nerves, and they're going to be creating like a group of bunch of nerves, and they're going to be going to create the peripheral nerves that we actually studied when we went into your muscle. Okay, so the first one is coming out from the neck, and it's going to be cervical plexus, and the other one is going to be the brachial plexus coming out from the arm. Okay, and then the third is going to be coming out from the lumbar plexus, and the rest would be the sacral plexus. Right, so now let's take a look now at what a spinal nerve is. Okay, so we actually noted that the spinal cord, okay, so let's draw the spinal cord again, and you have that butterfly, the pointed end of that butterfly is the one touching the end of the spinal cord. So with this picture, we can identify which is anterior and posterior. Okay, so again, I said pointed end is our landmark that tells us anything here is going to be posterior, and then anything here is going to be anterior. Okay. now we have positions now. Okay. Then the spinal cord has nerves that is on top here, and then a ganglion located at the top portion, and then meets up with the root at the bottom. Okay. And the name here is going to be the dorsal root, and here is going to be the ventral root. Okay. Remember, dorsal root is made out of sensory, and then ventral root is motor. Right, so this is going to be nerves. Sensory nerves means coming back into the spinal cord, and these are nerves called motor. It's coming out of the spinal cord. But in the area that you see here, this is going to be called the spinal nerve. The spinal nerve is made out of motor and sensory. Okay. Now, at the end of the spinal nerve, it's going to branch off, and the branches are called rami. So this is going to be going to the back. So we're going to call this dorsal ramus, and then we're going to call this the ventral ramus. Remember, those ramis have both motor and sensory. Okay. Now we're concerned here is going to be the ventral ramus, because these are the ones that we create your plexus. That's the one that we'll concentrate on. Okay, so we have the dorsal root, and the ventral root. And then we have the ramus branching off to the spinal nerve, going into the back. And then ventral ramus, which is going to be coming from the bottom or the ventral portion of the spinal cord. And then we have the sympathetic chain ganglion coming from the rami cuneus, which is a connection to the ventral ramus. Okay, so we'll take a look at that once we go to the autonomic nervous system. Now this is going to be the picture of your spinal cord again. Okay, now if you take a look at the dorsal root ganglion, ventral root, and then after that they become one here, and that's going to be the spinal nerve. The spinal nerve is the one that exits out from the vertebrae. So those are the ones that you will see outside the vertebrae. Now, the spinal nerve would then actually branch off into two branches called ramus. So this is going to be, which is going to be another side here. A branch of the spinal nerve is going to be the dorsal ramus. And then this one is going to be a branch which is going to be called the ventral ramus. Okay? And the rami communicanis is connecting out from the ventral ramus and become your sympathetic chain ganglion. So this is going to be part of the autonomic nervous system. But when I actually see what happened to the dorsal of the ventral ramus, those are the ones that we actually want to follow. So the dorsal rami is innervating the back muscles, and then they also innervate horizontal strips of muscle and skin that is located within their segment. Okay, so that's going to be the dorsal ramus. The ventral ramus, those are the ones that actually go down to the ventral portion of the body. Okay, and then they got branches, and remember these branches are motor and sensory. So the motor part is going to stimulate the nerves, the muscles located at the area, and I'm looking at the area of the chest. So it's going to innervate the intercostal muscle. Okay, but it's a branch called the lateral cutaneous. Okay, and if you follow the end of this branch called the intercostal nerve, and remember that's the nerve that passes through the costal groove. If you follow this one, you're going to see it goes back into the skin. Okay, so I'm going to put a dark color. So this one will go down into the skin and innervate the skin surface. That's the reason why they call it the cutaneous nerve. So it's lateral and anterior cutaneous. And then some of them will go to the back. And those are the ones for sensory of the skin. Now this is now called the ventral ramus. Now this is going to be the dorsal ramus. Dorsal ramus just goes innervate the muscles of the back. Then we have a cutaneous branch that will innervate the skin at the area of the back. Now, what are we looking at is going to be the ventral rami. Okay, and the ventral rami follows the intercostal nerves. And then after that, they give off lateral and anterior cutaneous branches coming out from the thoracic region. But remember, the ventral rami, some of them will actually create what we call nerve plexus, because they need to actually go into the limbs. So they actually create this network of intertwining nerves, and these are actually made out of ventral rami. So except T2 to T12, they cannot create plexus because you don't have arms located at your chest and your abdomen. So you can only create plexus because they need to actually go and serve the limbs. Okay, and then that is going to be crisscross of ventral rami, which is going to be what we call the plexus. Remember, the plexus is only created by ventral rami. It's not created by the dorsal rami. So the first one is going to be called the cervical plexus. The cervical plexus is actually very deep into the sternocleidomastoid. So if I see a person's neck and I see the sternocleidomastoid here, okay, the cervical plexus is going to be underneath that. And that is called your cervical plexus. Now, the cervical plexus will create a nerve that is actually the one that we're interested on. And that nerve is the phrenic nerve. That phrenic nerve is a nerve that is coming out from the cervical plexus. It actually came out from the ventral rami of C1 to C4. So the cervical nerves 1, the cervical nerves 4, okay, would actually create what you call the cervical plexus, and then eventually would actually create the most important nerve of that cervical plexus is going to be called the phrenic nerve. Now, the phrenic nerve is the one that innervates the diaphragm muscle. So just remember that. That's actually the muscle of respiration. Okay. Some of the nerve actually innervate the muscle of the anterior neck. So that's for the skin surface of the neck area. Okay, what we're trying to actually identify is actually a nerve that's located in a cervical plexus called the phrenic nerve. Okay, right now we're going to be moving out into the brachial plexus. Now the brachial plexus lies in the neck and the axilla. They are formed by ventral rami of C5 to C8. You got C5, C6, C7, C8 up to T1. Okay, so those are the ventral rami that create what we call the brachial plexus. Now, if you take a look at those rami, the rami will create trunks. So if you imagine 5 of those ventral rami, then will create 3 trunks. And after they create 3 trunks, you actually create divisions. You're going to create 6 divisions. And after creating 6 divisions, you're going to create 3 chords. That's the reason why the plexus is called crisscrossing of nerves. Eventually, the 3 chords is the one that will end up to become your peripheral nerves that is located at your arm and forearm. Okay, and those are the nerves that are called MURAM. M-U-R-A-M. Remember, we studied this when we actually look at the muscle. Okay, so the first one is going to be the musculocutaneous nerve. Okay? So the musculocutaneous nerve innervates the compartment in the arm, which is the anterior compartment. Okay, so this is something that we actually studied on the muscle. So the anterior compartment is made out of your biceps brachii and the brachialis muscle. And those are the muscles that are being innervated by the musculocutaneous nerve. Now the median and the ulnar nerve, the 2 nerves innervates the anterior compartment of the forearm. So those are the anterior compartment forearm, meaning the muscles on the anterior compartment forearm are innervated by the median and ulnar nerve. Now the radial nerve is extensive. Okay, and then remember the radial nerve came from the brachial plexus. And then it would actually travel down to the back of the humerus, and the back of the humerus, it will actually cling to the back of the humerus in order to go to the posterior compartment. And the radial nerve that clings into the back of the humerus will create what we call the radial groove. Remember, we studied that on the skeletal system, in which the indentation located in the posterior mid-shaft humerus is called the radial groove. Okay, so the radial nerve then would stimulate the muscles located at the posterior compartment of arm, which is going to be the triceps brachii, and also will innervate the posterior compartment of the forearm. And those are your extensors of the forearm. Okay, remember the extensor carpi radialis longus, extensor carpi radialis brevis, the extensor digitorum, and your extensor carpi ulnaris. Now the last one is going to be the axillary, and most of the axillary muscles are located to be at the shoulder. Okay, so these are the peripheral nerves that we studied when we went into the different muscle group. Okay, and that is now known that they actually came from what we call the ventral rami of C5, C6, C7, C8, and T1. And that is what the brachial plexus is made out of. Okay, so the nerves, as I said, is musculocutaneous, the median, and the ulnar. Then you got the radial, the axillary. Okay, so they actually come out from the brachial plexus as what we call the peripheral nerves. Now we're going to be looking at this picture here. Okay, so as I said, the ventral rami starts here. Remember, plexus came from ventral rami, and then it's going to actually become your roots. This is going to be the ventral rami, and then it's going to become your trunks. And after the trunks, is going to become your divisions. And after divisions, it's going to become your chords. And after chords, it's going to come as the M, viscocutaneous, U, ulnar, R, radial, A, axillary, and M, median nerve. Okay, so these are nerves, the peripheral nerves that you actually see at the edge of the brachial plexus. Right, so in this case, this is how to identify those peripheral nerves. Okay, so number one. So the first way, the first part of this is actually I want to look at landmark. Okay, so I want to need to actually identify a nerve. Okay, that is actually going to be very easy to look. Okay, so in this picture here, it doesn't actually continue on with the ulnar nerve, but the ulnar nerve is usually what I use for a landmark. The ulnar nerve goes underneath the elbow, and then when it goes underneath the elbow, it exits out here to the side, the area of the pinky, because remember, the pinky is actually where the ulnar bone is. Okay, this is actually the posterior. This picture is actually posterior of arm. Okay, so you see that the ulnar goes down at the elbow, and that's actually a nerve that when you hit your elbow on the table, you're gonna actually have this electricity coming from. That is actually due to the ulnar nerve. Okay, now the nerve that's spiral to the ulnar nerve is going to be called the median nerve. The median nerve is going to be parallel to that one. So it's going to be more onto the anterior surface. So I did M, then I had U, and then I'm going to have R. So this specifically tells you what happened to the radial nerve. Radial nerve came from the armpit area, and then from there, it goes to the side, and it goes to the posterior part of the humerus. The posterior part of the humerus is where the radial groove was created. So the indentation created by the radial nerve is called the radial groove. And remember, this is actually the nerve that you want to be careful, because if you fracture your humerus, your arm, you may actually accidentally cut it, because the fractured ends is going to be so sharp, like it's going to be like a knife. That's the reason why if you have any injury in an arm, you have to stent it and prevent it from moving. And that's because the radial nerve is the one that hugs into the humerus. So that's going to be your R. Then after that, your A is going to be your axillary. And the last one is going to be your musculocutaneous. But usually you see it at the anterior part. Okay? Again, how do I know this is the posterior? This is actually the olecranon process of the ulna. Okay? So again, the olecranon process of the ulna tells me that is that's showing me I'm at the posterior part of the arm, okay? And this is in anatomical position. The palms facing forward. The thumb is on the lateral side, and the pinky is on the medial side. Okay, and here the scapula is seen. The only way you can actually see the scapula if you're looking at the back. Okay, so that's actually the way to identify your position. We studied about body position, and this is a way to actually identify what position you have. Okay. Okay. Now, so the lumbar plexus now is the next nerve. Okay. So what is the lumbar plexus? Lumbar plexus is a nerve that's made out of ventral rami of L1, L2, L3, and L4, so the lumbar spinal nerves. Now, that is actually the plexus that would create two nerves that is important to us, and we studied it also in muscle. The two nerves that is created by the lumbar plexus is called the femoral nerve and the obturator nerve. Okay. Now, what does a femoral nerve innervate? Remember, that's the one that innervates the anterior compartment of the thigh. Those are your quads. Okay. And then what does the obturator nerve innervates? The obturator nerve innervates the medial compartment of the thigh. And those are your adductors. So now we know where the femoral obturator comes from. It actually came from the lumbar plexus, which came from the ventral rami of L1, L2, L3, and 4. Okay? So before we continue on, okay, I'm wondering what happened to T2 to T12. So what happened in ventral rami of T2 to T12? And they have no plexus. So what happened is the nerves that actually just go straight into the surface of their body. So the ventral rami would go to the ventral side of the body, and the dorsal rami of T2 to T12 will just go to the dorsal side of the body. They won't create a plexus because we don't have arms at the area of the chest and abdomen. Okay, so the lumbar plexus would be the next one, and then after that, okay, before we go, and I want to show you where the lumbar plexus is. This is L1, L2, L3, and L4. So they're the one that will create what you call the ventral rami's that will create your lumbar plexus. So this is going to be a lumbar plexus. And the two nerves that are important for us is going to be the femoral. It's a little bit bigger nerve that goes anterior into the thigh, and then it's going to be the obturator nerve that goes through that hole onto the bone. Okay, remember that hole that is created by the ischium and pubic bone? That hole that you see here, that is called the obturator foramen. So the obturator nerve passes through that hole, and that's the reason why we call it the obturator nerve. So the obturator nerve is the one that will take care of the adductor muscles, medial compartment, and the femoral is going to take care of the quads, anterior compartments, right? Okay, so now we've found out what happened to the lumbar plexus. So we're going to move on to the sacral plexus now. Okay, so the sacral plexus came from L4. Okay, so if I run down the whole spinal nerve, it's going to be L4, L5, S1, S2, S3, and S4. So what is those that came from those spinal nerves? Those are the ventral rami. Okay. Because the rule is ventral ramus is the one that makes up your plexus. So the area that actually introduced the L4 to L5 is going to be called the sacral plexus, but apparently we considered it as a lumbosacral plexus. So instead of just two separate plexus, sometimes we consider it as one. We call it lumbosacral plexus because remember, lumbar plexus L1, L2, L3, L4. And the sacral plexus is sharing L4, L5, S1, S2, S3, and S4. Okay? So the sharing of the L4 makes it like one group called the lumbar sacral plexus. Right? We're going to consider it separate. We're going to have lumbar plexus and sacral plexus. Now, the sciatic nerve is the one that comes out from the sacral plexus. That's the largest nerve of the sacral plexus. In reality, the sciatic nerve is actually not one nerve. It's actually two nerves in one sheath. It's actually two nerves in one sheath. So the two nerves is the tibial nerve and the common fibular nerve, sometimes called the common peroneal nerve. Okay, so remember, these are nerves that is inside the sciatic plexus, sciatic nerve, but it's in one sheath. And then before it goes to the back of the knee, it then separates in these two branches called the tibial and common fibular. Okay, so we're looking at the name. Okay, you actually know where it will go. Okay, because the name actually signifies where the nerve would go. Since the tibial nerve has the word tibia, you would follow that nerve going to the tibia, which is on the medial side. And the other one is going to be the word common fibular, so it has the fibula. So you would expect that nerve to follow the fibula, which is on the lateral side. So when they bifurcate and divide into two, or actually they are in one sheath, and then you see them going out from that sheath, then you have two nerves. So wherever you want to find the tibial nerve, just look for the tibia. And wherever you want to find the common fibular nerve, just look for the fibula. Fibula is always lateral. Okay, so the tibial nerve innervates the anterior compartment of the leg, And your fibular mostly is the one that will actually be the posterior compartment, lateral compartment. Okay. Now the innervation of the lower limb, okay, we have another group that is going to be at the area of the gluteal area. Okay. So those are the innervation together that comes out from your plexus, the sacral plexus. All right, so now if you take a look at some of the nerves from the sacral plexus, they have the word gluteal. So the branches coming out from the sacral plexus, they will actually go into the gluteal medium. Okay? And those are some of the nerves that will stay within that area. Now we're going to go now into your nerves. Okay, so wait a minute. So your nerves, okay, I'm going to follow the sciatic. Okay, so this is going to be a sciatic. This is coming from the sacral plexus. Remember, the sciatic is actually made out of two nerves in one sheath. Okay, since this nerve goes into the medial side, you're going to call it tibial because the bone on the medial side is called tibia. Now, the other nerve that is in green, okay, so I'm just following the nerve that forms the sciatic nerve. And then this is going to be separating, going to the lateral side. And the lateral side has what you call the fibula. So I'm expecting that nerve to be called the common fibular nerve. Okay. So you notice they actually separate at the level above the knee, above the back of the knee. Okay. So they actually start to actually separate just above the back of the knee. Okay. And those are the two nerves that are very important for our study. Okay. So remember, we'd actually trace the motor and the motor part. Together, there's going to be sensory in that nerve, okay? But the sensory, we're going to concentrate now on the sensory. So what do we see on the sensory? That is going to be the dermatomes, okay? So we're concentrating on the sensory nerve that is located with those peripheral nerves. And we're going to see where do they actually innervate. So just remember, upper limb skin is supplied by the nerves of the brachial plexus, and the lower limb that is supplied in the anterior as the lumbar and the posterior as the sacral nerves. Okay. Now, if you take a look at this dermatome, this is actually what a dermatome is. It actually represents the sensory nerves of the spinal nerves, and it actually is innervating the region of the portion of the body because that's how extensive some of the nerves, the spinal nerves, the sensory nerves would actually go through. Okay, I'll give an example. Number C2, C3, C4. Okay, it generally goes around the neck. Okay, so you stay around the neck. If you take a look at the back, they also follow around the neck. C2 is mostly on the posterior scalp. C2, C3, C4, and the C5. Okay, now the ones on the C6, because remember, the C5 to T1, those are the ones that create the brachial plexus. So you would expect those nerves to go down into lower extremity. I see my C6 going down here, innervating the skin and also going into the area on top of the brachioradialis muscle. Looking at the thumb, that is where the brachioradialis muscle is. But remember, this is sensory. We're not innervating muscle on dermatomes. We're innervating the skin. Okay. So the C7 again still goes into the brachial and your antebrachial, and then C8 also. Okay. So we'll go back and see the front. My C6, my C5, C6 still goes down into the brachial, go down into the upper extremity. Okay. Now, if you see the example here, then the thumb area, okay, these are the areas where you want to feel sensation after. The pads of the thumb is represented by C6. Okay. And then the lateral two fingers, it's going to be represented by C7. And then the medial two fingers is represented by C8. So what do I mean by represented? It's actually represented by sensory nerves that is going along those peripheral nerves. Okay. Now, once you go down, L1 will actually go around in the thigh. L2, L3, L4 is 5. Okay. And L4 is the one that goes around the toes. So when I would check my L4, when I check my L4 dorsal root, I want to actually get a needle and prick on L4, which is getting the big toe area. And the person would not be able to feel it. That means they lost sensory at the area of your dorsal root. Okay, but we got to find out if the muscle area, because remember the nerves at Rama has sensory and motor. So if you got paralysis of dorsal root, before you decide that it's a paralysis of dorsal root, I want to see if my motor is actually going to be affected also. Okay, so that's the reason why I've got to check sensory and motor. Sensory and motor tells me what level of paralysis I have. If the paralysis is located at the area of the peripheral nerves has motor and sensory, so the area of that nerve would actually be paralyzed, and you're going to see a segment around that area that it's not going to feel sensation, and it's going to paralyze some of the muscles within a compartment. Okay, so this is how it looks like on what we call the dermatome. Okay, so dermatomes is another physical examination that we do to check if the damage is at the nerves area, or the damage is located at the branch coming out from the spinal cord, or if the damage is coming out from the brain. Remember, the brain usually the damage is half body paralysis, which is similar to a stroke. Okay, but if you just have some deficiencies on area of your body, okay, I got to determine, is it at the area of the spinal cord or is that the area of the peripheral nerves? Okay, so that's the technique we do for physical exam. So we did dermatomes, and again, the disorders of your PNS, the spinal nerve. Now, shingles is really a viral infection. Okay, so the people that had chickenpox, the virus didn't leave your body. It actually stays at the area of those nervous system. Okay, and that's the reason why when they erupt because of stress, you will actually feel painful eruption because they go through what we call the nerves. So they follow where the nerves are. So that's the reason why it's very painful. And usually experience it by over 50. Now, my experience about surgery is that usually when somebody is post-surgical patient, suddenly when they recuperate from the surgery, they actually develop what we call shingles. Yeah, so it triggers your virus to be activated because of stress, and those viruses are the ones that you had in your head chicken box before.